My name is Tahsin Ozpolat. I am currently fellow at the University of Washington at the hematology department. I am hoping to help share my experience today, how things work for me as an IMG. Hopefully, I will go through the process and then later I will try to get your questions and then we can go deep in details. Let me share my slides. So today I'm going to discuss about the alternative pathways for the IMGs other than traditional residency pathway. The So, who are IMG? We are all IMG, like people who get their medical training out of the United States or Canada. They, I mean, all of us has a good medical training. Some of them even have additional specialty or subspecialty training. Why it's important IMG for the United States? Almost 25% of the US physicians are IMGs. We, I mean, all IMG include to this country give back different backgrounds and expertise, and then it's important in the patient care. So the regular traditional pathway, as everyone know, is getting matched into the residency. So for that, we need to get the exam step one, step two, OET, and then later match through the NRMP, later get get into the ACGME accredited residency, which is mostly internal medicine or pathology. And then after residency, we need to get the board exam and then start to work as a independent physician. So there are some limitation for this traditional pathway. Residency spots are limited. Visa sponsorship is a big challenge for the IMGs. And then match getting like the process of match is really difficult. Most of programs they use filters, they use different eligibility criteria to exclude the IMGs. The most important one is the graduation year. If you are, let's say, more than 3 to 5 years graduate from your med school, usually they exclude you. And then, of course, there's application process, cost of living in the United States, different states, it's super expensive. So the we need to explore another alternative pathways for the IMGs. We are all we all have training. We are all doctors, and then we cannot practice in the US without residency. But they United States health system like simply they need us and we need the work. So that's why we need to find alternative pathways. So number one alternative pathway for the IMGs is a research, finding a postdoctoral research position, working as a lab tech, clinical researcher, or clinical coordinator, like coordinating clinical trials. Those are usually temporary job for the IMGs. These jobs help us to find like a connect, establish a network and publishing paper to get into the residency pathway. But there are some cons and pros in this research position. It's not easy to find research position. For this, I have some research background and research experience. If you guys have more question, I can go in detail about the research positions and research questions after the talk. The other possibility is everyone, I assume everyone in the TIMGA, familiar with these positions, MDCE. Some states like Washington, they have a special rule for the IMGs. The IMGs are able to practice under supervision, so they can simply work as a nurse practitioner or APP. These positions also help the IMG for finding job and the prospective application for the residency position. I think this is also a good opportunity for IMGs, especially people who lives in Washington, Chicago, I think a few more states also, they have these opportunities. The Today, my main focus is internal medicine special pathway E. We are going to go detail about this pathway. I will share my experience also, and then of course I will. If you guys have more questions, we will go detail. So simply, the without residency you cannot do anything in United States, but there is actually another pathway. If you have training in your country for internal medicine residency, actually you can directly go for internal medicine subspecialty fellowship training. This can be nephrology, ID, geriatrics, even some competitive fellowship in some cases. So I will try to explain this pathway as an alternative pathway for the IMGs. So for this pathway, again, you need to have your internal medicine training from your country, and then sort of you need to be a exceptional candidate for the fellowship position. So this pathway E, I think it's Board of Internal Medicine, American Board of Internal Medicine approved this special pathway in either September or October. It should be September. So simply it says if you have internal medicine training or subspecialty training in your country, and then you are eligible to work in your country, home country, plus if you have fellowship training in the United States and your training institution, if write a letter for you, say, this doctor is an exceptional person. We strongly recommend this guy to be practiced independently. American Board of Internal Medicine approve your uh, previous education from your country, previous your training in your country, as well as your fellowship here, and then you are eligible to sit internal medicine board immediately. So the main change is with this pathway. Previously, again, you were able to go for fellowship training without repeating internal medicine residency in United States, but at that time, there was two pathway. One, either you need to go back, repeat your internal medicine residency, or you need to find a job in the academic place, academic institution, work as a attending physician for 3 years. After 3 years, you were able to sit for internal medicine board exam. But now they say once you finish your fellowship training in the United States without repeating your residency, without working as a attending position, without waiting, you can immediately sit your internal medicine board, and then start the practice. So again, you can start your fellowship training in the United States. You don't need to repeat your residency. After you finish your fellowship, you will apply for the Pathway E and then sit for the internal medicine board, and then later you can get your subspecialty board exam, and then you can practice independently. The who like Are you eligible? This is the question. Number one, of course, you need to have your residency, internal medicine residency training from your country. It should be minimum 3 years. So once you have that, you can apply any fellowship position in the United States. Geriatrics is 1 year. Nephrology ID training will be 2 years. Hemonc, cardio, GI 3 years, and I think pulm also 3 years. So depend on the subspecialty. The training times are different. Once you finish your fellowship training, either 1 year or 2 years or 3 years, it doesn't matter. So once you finish 1 year fellowship in the United States, you are able to sit for internal medicine training. So how to get that fellowship positions? Usually you need to apply for the fellowship match, and then for the getting on those positions, most of program look for, is this guy has enough experience in the subspecialty such as nephrology, geriatrics, or ID. If you have subspecialty training from your country, this is really good. They are looking someone with experience. If you don't have that subspecialty experience or training, they look for your research background. If you have enough research on that specific field, such as infectious disease or nephrology, do you have a few papers to show you have enough exposure in the field, or you have sort of expertise in the field? So, and then if fellowship programs feel like you are good candidate, usually you are able to match those program, and then once you finish your training, the rest of it will be paperwork, and then you will apply for the internal medicine board, and then after that you are free to practice. The advantage are it's quick way to get certification, and then it's also good for the United States. They need subspecialty training people. They need more expert in the area, in the especially rural area. The another advantage, you don't need to repeat your internal medicine residency. But of course, there are limitations. The fellowship training is not easy. The programs are a little bit picky. They want to get, of course, the best candidate for them. You need to have strong application. Again, they call those people as exceptional, which means either they have subspecialty training from their country, or they have good research background. And then another problem is visa problems. If you have your, I don't know, green card citizenship, of course you have advantage, but still most of fellowship training program provide J1 visas. Sometimes they also provide H1 visa, but I think H1 visa is a little bit difficult to get it. Uh, so this pathway is for the IMGs who already has a internal medicine training in their country, and then they can get fellowship training in the United States, and then later. They can practice here independently. The goal in this pathway, there are actually some subspecialties are not desirable for the American graduate, like geriatrics, nephrology, and ID. These programs are not able to fill their position, so that's why they need IMGs. They need to fill this program. They need more subspecialty expert. So that's why they are trying to get like this pathway is approved because of the need. Uh, this is all I like my talk. I wrote two different article about this topic. You can find the link on the end of the talk, or I can share the in the chat if you guys want to read more. And then, of course, you can check the internal medicine, American Board of Internal Medicine website for the detail. I will, I think yeah, that's all my talk. If you guys have question, we can little bit go in detail, and then I will be happy to help you guys. By the way, I don't do any consultation job. I don't make any money for this. I am doing this because TIMGA helped me in the past, and I am hoping to help other IMGs for the TIMGA members. And I am sharing these articles in case if you guys want to read more. So, do you guys have any questions, or do you want to learn more details, if anything, or other than the special pathway as an IMG? If you guys have any question, I am happy to help.
So, may I have a question?
Sure, yeah.
So it is for internal medicine only, for
So,
geriatrics and nephrology, but not for pediatric nephrology or anything.
so do you have a training on pediatric?
Yes.
So actually, it's pediatrics also nephrology is they have hard time to find trainees. So I will recommend you to just send them email today. Today is the match day for the fellowship. You can just email them, ask for if they have available position, and then send your CV. Say you have interest with the nephrology. They will back to you. And then once you get your training, this is special for internal medicine, but this pathway, once you get your fellowship training, you can still work as a faculty in the academic institution for 3 years. After 3 years, you are able to sit for board. So this is the pathway for the pediatrics.
Oh, where can I contact?
So you need to find on-field spots for the pediatric nephrology. So unfortunately they haven't published this year on-field spot. But there is like for 2024 on-field spots for pediatric fellowship. If you do Google search, you will find which program did not fill their fellowship position. I can
Hmm.
share that. I can share that link on the chat too.
Okay.
Give me.
So today is the last day for.
No, today is the match day. Uh, Today is the match day. They're like the on-field position will be posted on NRMP website in a couple days. You can find those program and just send them email, the ask for like if is that possible to get an interview for the on-field position.
Okay. Okay.
So I share a link on the chat that is for 24 last year on-field spots. So you can take a look just briefly. You will have idea which pediatric like subspecialty has an on-field spot. You will some idea. So
Okay.
the there's a question on the chat. If I stay in New York City, can I work as an MP in Washington, D.C.? I think New York City also has a this sort of MDCE position, but I'm not sure about the Washington D.C. I don't know. The Dr. Khalif, I think he's planning another session for consultation. They post on the chat, the Telegram chat. So you guys ask him. He knows better than me.
Okay. Thank you.
Yeah, thank you. So there is another question. Can an IMG work as a faculty in a health science university with their previous from outside the United States? If so, which states available? Or so there are some. Personally, I know some people. Uh, they have their like degree from their country for nephrology and ID. Some of them need the repeat fellowship and then they got position like as a faculty position. Some, a few people, it's really tough, it's really difficult. They have strong background on clinical work. They also have strong background on research. They didn't even repeat the fellowship training. Immediately they accepted as a faculty. The second one, the latter one is difficult, is you really need to be an expert in your field. It's all over the United States. There is no limitation. It's just like depend on the program, depend on the university. If they want you, if they want to work with you, they will find a way to hire you. So yeah, the traditional fellowship application is through the ERAS, like a residency. This is how match work. You apply for ERAS and then you do interviews. Later they rank you, you rank them, and then you match or not. After match, there are on-field spots, and then the programs look for good candidate. You guys need to find out which program has an on-field spot and you guys need to contact with them. If they really interest with you, they will contact with you and then they will schedule an interview. It's called like scramble. There is no time limit from today to May. Like they have 5 months to fill their program. You guys just need to find out which program has a on-field spots. For fellowship, its application time is somewhere around July. I think it should be either end of July or mid-July through the ERAS. You need to apply from the ERAS. So there is one more question. If I am a GP in my home country, I am not eligible unless I become internist or pediatrician there. This question, if you just look for guide like a rule, internal medicine, American Board of Internal Medicine board say you need to have your internal medicine training there. But if you find on-field spot, let's say for geriatrics or ID or nephro, and you show your interest that program, and they like you, they like your CV, they may do exceptional pathway for you, but it's not easy. So usually they look for people who has a training, people who has a good research paper. They try to choose those candidates. Okay. Any other question or anything you guys want to go? Okay, there's one more question. I am IMG from Burma, Myanmar. I was a psychiatrist working government hospital more than 20 years as a specialist of physical medicine and rehabilitation. But the point is I cannot get recommendation from our country because our country situation. How can I do for that? I want to know, is there any exemption for that? So I think you are asking me you cannot get recommendation letter from your country or proof for your education. That's little bit hard. For recommendation letter, I don't think there's any limitation. It's just a letter, but I don't know if you trying to say your proof for your education, that part you need to contact with ECFMG, you need to get ECFMG certification to do all this stuff. So I think first you need to focus on ECFMG, getting ECFMG certification. Yeah, the any advice to fill clinical gap here in Washington? I think number one, if you guys can do MDCE position, those are good positions for the hands-off experience. Number two, observership is not good enough, but that will help you to do some networking. Number three could be looking for research positions. That's also uh, in research positions, try to work with the MDs. They have also network, they have connections. So you guys, I mean, they will write a good, if they can write you a good recommendation letter, that will be also helpful. Uh, I think MDC positions, observerships, and research, those three will be helpful for the clinical gap. So clinical research job is usually what they do. They are looking for someone can write IRB protocols like, ethical board, those things. You need to have good writing skills, little bit research background from your country, and then Number three is sometimes you need to contact with the patient to get their consent. They usually they look for if you have good English, if you have good communication skills. Those jobs actually, if you live in Seattle, Washington, Fred Hutch, Swedish, Virginia, not Virginia Masons, Swedish Fred Hutch, again, University of Washington. Those are, they do a lot of research. Try to look job opportunities on LinkedIn, Glassdoor, and again the networking. If you get any connection in clinical field who is doing research, clinical research, they will really help. Uh, any advice on how to find MDC position? It's really hard to get one, and even with the cover letter, TIMGA. So yeah, I think Dr. Khalif is planning to do one-to-one consult session soon. He's I don't have any experience on this. I think he will be good sources for you. Can TIMGA help IMGs to find the healthcare entry-level jobs such as MA? Uh, Peace is, I think she is managing all those coordination. I can't talk. Uh, I don't know how things work, but whatever I see from the Telegram chat, I feel like they are trying to help. They have sub Telegram chat group. They are trying to help the people, but I think you guys need to send an email to Peace for those details. I'm sorry, I don't know that many details about the other like medical assistant jobs. Uh, okay, if there is, let me see, Peace. If I think let me find the TIMGA's email address. They usually use one email address. If I can find, I will type for you. So there's one more question. Hannah is asking, can I find a MA job in Washington without the MA certificate as a temporary job? I don't think so. You need to still get temporary MA certificate. So if you have residency from your country, I think if it's internal medicine, maybe you can focus on fellowship positions, and also you can uh, try to focus on MDC jobs. So I mean, I think yes, it's not easy to find one of those jobs, but I heard a lot of success stories. Hopefully you guys also can do it. Okay, I think will be last 3 minutes, and then if there's more question, I will be happy to help. Is MA job strange the CV for us? Yes and no. It's yes, because you will be in the clinic, you are going to do network. You will closely work with different physicians, so likely you can get or ask for letter. This is yes part. No part is technically if you do, I mean, MA is little bit like the in United States system, MA job is little bit like applying for med school, applying for nursing, but for residency, yes, there will be some help, but it's not going to be strong as MDC job. Any question about the fellowship or fellowship application or uh, research? So, any suggestion for me when I am still preparing USMLA and I want to find temporary job? If you, I think you also mentioned you have a residency experience. The best fit for you will be research, even if they don't pay you that much. If you get into research position, it will be really helpful. So for your future and for networking, publishing paper, it will be really helpful for the future residency application. You can look for lab, like a lab technician job or postdoctoral research job, or again, research coordinator's job. Those are, if you already have a residency training, I think you will able to deal with those jobs.
Thank you very much. I also want to ask about, um, in terms of research job, do you think is the lab technician or clinical research assistant? Which type
So
of job do you think is?
if if you have research background, best job will be postdoctoral, like postdoctoral fellowship, which is research position. You can publish paper, you can do your research and then you will have a mentor. The research fellowship will be best. Even they don't pay that much, they maybe tell you they are not able to pay you, but it's still worth to do it, even 6 months, 1 year. Those are the best jobs. Some researchers, they just have database, but they don't have time to work on it. They just need help. So let's say I'm just making up uh, patient with rheumatoid arthritis with kidney dysfunction. They have database, but they don't have time to go details. So if you can find those kind of job, if you can do chart review, that will be a paper for you. Or if you can find lab-based job, that will be a little bit better job, better position. But lab-based research usually takes time compared to clinical research. I mean, in terms of publishing paper.
Yeah, thank you. Thank you very much.
Thank you. What is the difference between ACGME accredited, non-ACGME accredited? So uh, let's say neurology has seizure fellowship. I think it's, yeah, that is non-ACGME. So they get some people train, you become expert on seizure, but ACGME doesn't have any rules, no regulation. They will give you a certificate and you will be expert on seizure, but it is like plus on your CV, but officially there is no meaning. Or uh, until this year, transplant nephrology fellowship, it was non-ACGME fellowship training. After you do 2 years of nephrology fellowship, you need, if you have interest with transplant, you do 1 year extra, which was non-ACGME, but you become transplant physician, and then your job focus will be a little bit different. But officially, again, it's just nothing. So they will give you certificate. You are like you will graduate from program, but again, it just plus on your CV. Officially, it doesn't. There's no meaning. So without ACGME accredited training, you cannot sit on any type of board exam. Yeah, that is the question is, does IMG without residency can apply for ACGME accredited fellowship? Yeah, this talk was all about this. So I think I will try to a little bit tell my story. Maybe this will be easy to uh, wrap everything. So I'm originally from Turkey. So I got my med school training over there, and then I did my internal medicine residency in uh, Istanbul. After that, I moved United States for research position. My plan was like staying 2, 3 years in United States and went back, like going back to my country and then practice over there. But life is change, and then my research project was like it takes forever, and then I stay in the research. Later, I realize I need to go back to clinic, but I had huge gap in clinical work. So I applied for residency, it didn't work, and then later I decided to go for fellowship. I applied for nephrology fellowship, and then I finished it. There was two pathway for me, either finding a nephrology job and then continue like work as a nephrology attending in the academic place, or I need to, like, my plan was repeating the residency again. The With this uh, American Board of Internal Medicine Special Pathway E, I don't need to repeat internal medicine residency anymore. I can sit for the board exam immediately, and then if I want, I can sit also nephrology board exam too. But I choose different pathway. I decided to do one more fellowship last year, and then I apply for hematology fellowship. Now I am doing my second fellowship as a hematology in the University of Washington. Sure. I hope, yeah, I hope uh, it will be helpful. And this is like the first time I gave a talk for team with TIMGA and for like helping the IMGs. I am happy to meet again, maybe a couple months later if you guys have more questions. Just you guys need to contact with Kali for peace. A couple months later, again, we can discuss more and details. I am happy to help you guys.
Thank you. Thank you very much.
Yeah, thank you. So have a good day. Have a uh, nice. It's we are in December. Have a nice year. Hopefully, we'll see you in couple months again.